All right, I'll get started. This is something none of us have ever dealt with before. We used to hear about, in the days before of this code 19 or chemical 19 or something like that, that they described it, we may be dealing with in some sort of chemical emergency or disease process or something like that. Well, actually, it's here. And, it's been very trying across the state. We're in coordination with the state emergency management offices 3 times a week. We have conference calls ongoing for this. And one thing that I want to reassure you with the county is we actually have one of the strongest of local emergency planning committees in North Carolina. Each and every week, there's probably up until the last few weeks now, we're doing it every first and third Tuesday. But we have no less than 75 agencies on board communicating with us about how we should handle this and how we're all unified and working with this together. As of today, I checked with the health director. We're up to 416 cases, and we have 331 people recovering from this right now. The county has done a great job thus far in trying to keep hold of this. However, as we start to open things up again, we're starting to see quite a bit of increase in the numbers, and it's all ages. It's not any certain age. The one thing I want to make sure I speak to as we get started, we hit the nursing homes and rest homes really early in this, and making sure that proper PPE was in place and protocol and procedure. And we have been so fortunate that none of those facilities have had an outbreak so far. And as you well know, across the state, those where all of the fatality numbers are mostly in those nursing home and rest homes. So we've been very fortunate. As of today, for example, there are only 2 deaths in the county as a result of the disease outbreak in our county especially. Moving forward, there's a lot of things that's going to have to be put in place. We've got to make sure that we clean, and that, we keep our distances from each other. And it's very possible that the governor, by Wednesday or Friday, may put in masks are required in the county. As you well know, Winston-Salem and Greensboro are already taking those steps, and they're moving forward aggressively with it. We are working with the health department daily, and they have done such a fantastic job of working with us. The hospitals have been dynamic. We've had mental health involved. We've had social services involved, law enforcement, all of the other support agencies in the county working together to make sure that all of us do the best we can in addressing this. I think it's something that we're going to be dealing with for at least a year. We may continue to see a steady increase in what we have in the county. It is concerning. We are trying to identify the congregate populations that may be causing a lot of the rise with this, and that's got to be, just speaking honestly, the processing plants, the food plants, the industries where you're standing shoulder to shoulder working each and every day. That's where we're seeing a lot of the steady increase in those positives that we have. Our hospitals, I know Northern hospitals tested well over 1,000. Few Chatham hospitals tested up around 2,000 people, and the tests are going on daily. The number of sick people that we're seeing in our hospitals growing quite a bit, and the number of tests that are being done routinely are there. There are 2 different tests that they're using. There's a 45-minute test that is what we call the quick test, and then there's the standard LabCorp service testing and state lab testing. Those take around somewhere around 2 to 3 days to get the results back. The 45-minute test that we're doing in the hospital has proven to have some issues. Some of those are showing false negative, and then as the person gets sicker or showing more symptoms, then they become positive. So there are some issues with false negatives. So, there's just a lot of issues that we're dealing with right now to try to address and this as best we can and move forward. Give you another examples. We've been meeting with the school systems daily on how they're going to re-enter the education programs, and doing that safely each and every day, creating maintenance programs within all of those programs that will identify the sanitation issues, the congregate type movements throughout the school system each and every day. For example, they've got a really hard job in trying to manage children who want to be hugging each other and on top of each other each and every day as they normally would. Even down in the smaller ages, they're going to be worse than that. So, they've got some very trying times ahead of them, and they're working hard to try to address those. Just trying to give you sort of a brief overview of where we are right now, and reassuring you that all of our agencies are working as hard as they can together, unified in the county, which is a normal for Surry County. In Surry County, the one thing you can be reassured of is there are no turf-related issues here with all of these agencies. They all want to work together in unity to make sure we do the right thing. And at this point in time, I'd like to take on some questions if I could.
One question I have, so I assume because there is a state director of emergency services, does every county in North Carolina have, I know they had them in Virginia, but does every county in North Carolina have somebody like you that is the emergency management director?
Yes, they do. All 100 counties in North Carolina have an emergency management coordinator or director in title, and we all work within that state emergency management system. And I know most of you've heard the gentleman's name, Mike Sprayberry. Well, Mike is our state director. Wonderful guy, large background in military and organization type activities. Mike's a great guy and has done a really good job with the state for several years.
Right.
But yes.
Yeah, I can imagine. I've seen Mike's presentation. So essentially similar but different to the military, the governor or Mike can call all the emergency management people together and have a coordinated effort like they've been doing on COVID.
Yes, that's correct. And we pool all of our resources through the state. We have a program called Sparta, and here it's called Web EOC, and that's the Emergency Operation Center web-based. We have had that system in county for several years. The state also has what's called Sparta, and we work in coordination with that each and every day on what resources are needed,
right.
What supply issues are out there. But yes, all of that's coordinated through the state office and out to the local counties.
Well, I know one of our members here, Joe Zalzik, who's has been involved in emergency services and firefighting in a community that he was in, and as a new resident of our area, asks, are you able to get federal funding to cover your expenses for COVID-19?
Yes, we actually have our finance office working daily on recovering the expense of the majority of this. We've already sent in, as much as $50,000 at a time on what it's taken to do this. And I will tell you, the PPE or the personal protection equipment for this has been really expensive, in that items that we used to pay 10 cents for, we're having to pay almost $1, and sometimes more than that. So, a lot of those issues have come forward because of the lack of supplies to make the PPE, and then what's actually available throughout the state. And as you've well seen, where it's hit the entire union, the demands for that PPE has been unbelievable. So,
right.
And the one thing I want to say is, we're going into this, we've had local people step up to the plate and start making PPE. And that has been overwhelmingly useful in trying to supply what the county needs. I'll give you an example. Ben Webb and his organization, they're putting out 2 million masks a week, and we're working with them.
Wow.
And we're working with Renfro. We're working with Nestor Hosiery, and we've got another corporation in Pilot Mountain that's working with us that started creating the PPE. So, you know, a lot of people working together to resolve these issues, but it's been quite expensive to cover the PPE usage because, as you can imagine, with the outbreaks that we have had and the close contact that all of our healthcare workers have had, the amount of burn rate that we have with these items daily is unbelievable.
Well, one of those companies, John, is joining us on this call. That's John Tarn, John and Betsy Tarn from Extreme Marketing. John, his company developed a face shield and giving many of them away. And in fact, John asked a question, are the sneeze guards, you think, going to be mandated for companies at their customer touch points, or is this voluntary now, or what's your read of that?
It is voluntary now, and I think that's a good aggressive step in trying to control the disease. The health department's absolutely recommending those type steps put in place. It is not mandatory at this time, but you know, as this grows and everything that we're hearing in the research says that it will grow, especially in the fall and winter. I see a lot of different things probably that will have to be put in place mandatory before this is over.
John Peters has joined us from the Mount Airy News.